if you want in the meanwhile, I think you can open your slides and start. Just give me a second before you start. So just open your slide. All right, go ahead. You can proceed.
Okay. Good afternoon, everyone. Today we'll be presenting HIV counselling. So our objectives for today are going to be encouraging thorough HIV counselling, trying to find a balance between informing patients thoroughly and not overloading with information. We want to modify our behavior and that of the patients, and of course to encourage adherence for our HIV positive patients. So the WHO has 5 C's of HIV testing, which include consent, confidentiality, counseling, correct test results, and connection to HIV prevention, treatment, and care. So what is counseling? So basically, it's a private conversation with a trained professional. We want it to be in the preferred language of the patient to ensure the best understanding for our patients. And we want information to be provided to the patient so that they can make informed decisions and so that we can encourage health promoting behavior with them. And of course, we must remember that this is a confidential process. So the basic requirements, this is just really the basics that we need, is a confidential and private setting, staff that are trained in HIV counseling and testing. And when we're doing the actual test, we're going to need the proper disposal of the waste products. So we're going to start with pre-test counseling. So what we're going to cover with pre-test counseling is a basic definition of what HIV is, what is AIDS, the transmission of HIV, the window period, the importance of knowing for the patient to know their status, a risk assessment of your patient. We want to encourage prevention of transmission, explain what the testing process is, and what the impact of the results could be for the patient. We also want to evaluate the coping mechanisms available to the patient and explore who they should tell, because as we know, notifying partners is most important. And then, of course, TB screening, as we need to. So explaining what HIV is. We need to make sure that we do this in a basic layman way so that patients can understand. So it's easier to always go with medical terminology for us, but we must remember that it can be quite complicated for the patients. So I've tried to give everyone a sort of basic explanation that maybe we could all use when we explain it to our patients. So HIV is a virus that attacks the immune system once the body is infected with it. It weakens the immune system by attacking the cells that protect the body from infection, and these are your CD4 cells, which then leads to the body being more susceptible to other infections, such as TB. And then because patients, and as we know, HIV and AIDS is quite linked, we also need to explain that being diagnosed with HIV does not necessarily mean AIDS. So then giving a basic explanation of AIDS, we can, as I've written here, so it's a more severe stage of HIV infection where the immune system is extremely compromised and the person can be severely infected with opportunistic infections. And then also like that there are AIDS defining illnesses, but that might be a bit too much when just doing pre-test counseling. So looking at transmission, we can explain to our patients that they can be infected when exposed to body fluids, such as vaginal secretion, semen, blood, and breast milk. And that can be in the as below: sexual intercourse, exposure to infected blood, mostly via shared needles amongst IV drug users, but there is also, blood transfusions, and then vertical transmission, which is mother to child. The window period. So this is a period of 6 to 12 weeks after potential HIV exposure, where a person who initially tested negative for HIV can seroconvert and test positive. And this is because infection does not always reflect immediately after exposure. Therefore, high-risk individuals should be tested more frequently. I found a little poster that might be interesting for people to look at if you look at our slides. So to summarize why it's important for patients to know their status, so the benefits must be emphasized to the patient because early detection results in earlier initiation of ARVs. They can start safe, positive living and have healthy lifestyle choices. So also emphasizing that knowing your status keeps both you and your partner healthy and safe because you can choose safer sexual practices. When assessing the risk of the patient, you need to explore the sexual practices of the patient and their recreational activities. There's a definition of high-risk negative people, which are patients with known positive partners or partners of unknown status. Our other key populations include people who inject drugs, sex workers, and men who have sex with men. These groups were identified because they're at higher risk of HIV exposure and transmission, as they may not access healthcare services because of social stigma and potential discrimination. Here we can also encourage ways to prevent transmission, as I've listed here: monogamous relationships, fewer sexual partners, consistent and correct use of condoms, and also explaining that there are male and female condoms available, discouraging sharing of needles, and if we can encourage some needle exchange programs that I know are available, post-exposure prophylaxis, pre-exposure prophylaxis, male circumcision, and treatment of STIs. So I won't go through the whole slide here, but basically explaining the testing process to the patient. We want to explain what we're going to be doing to the patient. So with the rapid antibody test, it's a finger prick test where a drop of blood is put onto the window of a test kit, and we put a special agent to test the blood. And then we've also got the option of an ELISA, where we do a blood test where we take blood from the vein, it goes into our test tube, and that is sent to the lab. Advantages of the rapid antibody test, it's quicker, you'll get your results same day, whereas ELISA might take longer for you to get your results. So here we also want to explain what a positive result means, what a negative result means, and an indeterminate result. So a positive test means that the patient has HIV, and a negative test means that the patient does not have HIV. However, we must remember to emphasize the window period, and the risk of the patient needs to be assessed for when they should test again. So then there's also the indeterminates. So this is where your first test, I forgot to, if there's a positive test, you'll have to get a confirmatory test that will be done using a different brand, right? So if it's an indeterminate result, that means that your first test was positive and your second test may have been negative. Here we'll repeat the testing process. If the results are the same, the patient will ask to return in 14 days so that they can be retested. ELISA, it's obviously all done at the lab, the test and the confirmatory test. If there is the discrepancy, the patient will be called back for a repeat test. Okay, now we need to explain what the impact of the results are for the patient. So a negative test, like I alluded to earlier, we need to encourage prevention of transmission and safe sexual practices, repeat the test as appropriate, and explain the window period. For positive tests, there will be same-day initiation of ARVs, bloods will be taken, and then we need to emphasize safe sexual practices and healthy lifestyle choices to prevent transmission. And then, as I said earlier, an indeterminate test will require repeat testing. So exploring the coping mechanisms of patients. So this is important because we want to know what the patient has available and what support the patient has. We need to explore the manner in which a patient has dealt with problems in the past, the impact of the results on the patient's life, and who the patient will be able to tell if the patient were to test positive. Who to tell? So notifying partners about the results is most important because it affects their lives. And it helps both partners in making healthy decisions. And we know that the partner also needs to come in for testing should the patient test positive. So we need to also remind them that their status is confidential. They can decide who else they want to disclose their results to. But we need to make sure that they understand there's a benefit and a risk for disclosing results to a broader group of people. So the benefit can be that it broadens their support system when dealing with the HIV or living with HIV. However, there is a risk of stigmatization when disclosing the results. And then obviously our TB screening. So once we've done this, the patient now will have an opportunity to ask any questions. There are also, they should be informed that they can decline testing once pre-test counselling is completed, and it won't hinder their accessibility to a clinic or medical treatment in the future. So we should try and discuss a later date for the patient to come so that they can test. And once we do get our consent, we may perform the HIV test.
Okay, in the post-test counseling, first we'll revisit the 5 C's, which are the principles of the HIV testing services. So the most important thing here is the connection with the counseling. It's the connections, which means it's linked to prevention, linking to treatments and support, and linking to care services. So first, like it's important for us as medical practitioners or as general practitioners to understand the biopsychosocial uh, biopsychosocial model or the biopsychosocial model of people. So first in the biology, first we have to understand that cognitive. This way we understand the importance of knowledge, understanding of results, disease, and treatment options, and behavior where you see that promiscuity, alcohol, and drug consumption, how they can contribute to occurring HIV or unsafe sex. So in the psychological sphere, also you have to understand patients that they are affective, like they are anxious beings. They can get depression, they get denial, fear of violence, and fear of stigma. And then in the psychological field as well, medical, we can see that patients are scared of what pill burden, where they receive a lot of pills, or there's a complex regimen that they have to follow, and also the medication, how it tastes, which is the medication palatability. And also continued intersocial as well. We also know, we also should understand that the importance of family and social support, where lack of community involvement, and dependency on partner, how that can lead to a patient not following through their treatment or defaulting or being involved in risky behavior. Also in the socioeconomic aspects as well, knowing the age of the patients, the sex, if like with the gender, understanding the stigma in the society or in the place that will be where the patient is coming from, and also the socioeconomic status of the patients and level of education. All of that is the importance in managing patients and seeing where they're coming from. The core goals of the post-test counseling is to impart knowledge to the individuals being tested. So first, the goal is to improve understanding, and also is to provide, but is to for the client to to be involved in the decision making. Also, we also advise them on how to cope. Also, like, get the also if they want to involve family or caregivers, and also we can later on have a reinforced discussions about everything that was spoken about. Also, the reason for the whole counseling is also to ensure quality adherence. So there's there's also a quality adherence counseling, where when patients who are positive, we can spend time with them and explain the disease, goals of therapy, and the need for them to adhere to the treatment. Also, we also discuss the role of treatment in the management of the condition. As well, we negotiate a treatment adherence plan that they are comfortable with and that they adhere to. And also, before we start patients on any medication, we also should explain to them the adverse drug reactions and drug to drug interaction and possible uh, consequences of mixing other prescribed or recreational drugs or substances. Also, is to the core goals as well is to modify client behavior, where we empower clients to manage their conditions, risk of not taking medication, and promiscuity, address fears and concerns regarding treatment, and encourage and recognition of adherence, and also offer them uh, support group for adherence, which will look at improving or encouraging their attendance and participation in the support group, and encourage self-reporting on adherence, and encourage a treatment buddy. So the approach now, in the HIV negative test, first we have to get the consent of the family patient if they want to know their results. Once we get that, then we start explaining the test results and the status, what it means, being tested, being having had a negative HIV test, what it means. And then we educate the patients on methods of prevention, the importance of knowing sexual partners' status, and availability of partner and couples testing services. And also retesting based on clients' level of risk exposure. Uh, that is in regard of the window period. And also the opportunity for clients to ask questions and request counseling. So for patients who the approach on patients who are HIV positive, who have an HIV positive test, first we get their consent. We make sure that the patient's details are correct, and we explain the results to the patient and the diagnosis. We also give them time to understand the results and to cope with their emotions, which is anxiety, depression, yeah. And then also we after we've given the patient after we've given uh, our clients, the healthcare service clients, that opportunity to cope, we can discuss immediate concerns and get immediate support. Also, we give them information on ads, uh, the benefits, where and how to obtain it, and then we do the active referral, which is the same day enrollment and ads eligibility assessment, which is done the same day. Uh, also, we and also we teach the patients the importance and ways to prevent the transmission of HIV, and also the importance of the viral suppression on ads and the use of condoms. Uh, the benefits of disclosure, we also where we offer patients couples counseling for support, and also we offer testing for sexual partners, children, and other family members. And then the second point, the other point is we assess the risk of the intimate partner violence and the possible steps to ensure physical safety of our clients. And then we do the mental health, where we stratify the risk of suicide and depression. We also refer for prevention, counseling, support, and other services during the post-test counseling. So the special groups, they are namely, they are allowed, but then I'm going to mention four special groups, which is pregnant and lactating women, children and adolescents, mental health care users, and substance users. In the women of reproductive age years, in their when you're doing their post-test counseling, we share the risk of transmitting HIV to the infant if positive, and to make childbirth plans so that they can have the access to the preventing mother to child mother to child transmission services. We also teach the patients on the use of ARVs for the and also the use of the ARVs for the client's health and preventing the transmission of the virus to the infant. And we get the and also we do the infant feeding options, we discussion with the mom, and support and benefits of early diagnosis in the child. As discussed last week as discussed by the previous group. Also, the other group is the children and adolescents. In the post-test counseling for adolescents, we should include a tailored hub linking HIV care and treatment, counseling, referral, and linking to specific psychosocial and mental health services, and also to inform the child or the adolescents on their rights and responsibilities, especially their right to confidentiality. And also we also hear we tell them on the issues related to sexuality, challenges that they may encounter in relationships, marriage, and childbearing age. We individualize the planning on how, when, and to whom to disclose their status, and engage families and peers providing support. We also do the referral to small group counseling and structured peer support groups for the thing. So in my conclusion, the importance of counseling and the essence of the post-test counseling and the counseling as a whole is to prevent the transmission of the virus, is to link patients to care, link patients to adherence, and retain patients in the care system. Sure, thank you.
Okay, thank you for that. Just some comments, and then we'll move on. When you're dealing with counseling, from what you've just heard right now, all of you instinctively would say, gosh, that sounds like a lot. That's not something I can do in my conversation or consultation usually. And that's a problem. And I think it's some of the caution I would say with regards to the guidelines and the information you've been given is that there is a lot of, please look at it again and think about it. there's a lot of detail that actually speaks to more exceptions, smaller groups, and that I think is quite useful for you to appreciate the slight subtleties around it. But when you are in your consulting room, you need to realize that instead of telling patients these things, and I think the guideline in the first presentation is really useful, the kinds of issues that you have to work through, you should not be telling the patient. You should be asking the patient. And you should get a sense of, do they understand transmission and what matters about transmission? Do they understand how treatment occurs or what the test involves, how tests happen? This is far quicker because you can get with those few questions that were around the topics that were dealt with earlier. You can easily get a sense of, and if you focus on them, you can get a sense of where that person is and whether they're ready for the disease, for the possibility of the disease. You should be, as I think was done in the first, the pre-test, actually add in some elements, and I'm not sure that it was there. But you have to assess a patient's mental state as well. You have to be able to establish, for example, if they really feel very sad or have been very sad, and whether there's any suicidal intent or ideas. So this is important before you land up doing the test and then discovering that. So I think the second presentation was also very useful in that it brought out the question of a psychosocial approach to it, which is there. But I think the fact that you need to deal with a person is really important. And I think if you look at it, these overlap. Now, in my practice, I actually don't think that there should be very much done in a post-test counseling. All the issues that we've talked through should be dealt with through questioning in a pre-test counseling session. And again, as the clinician, you need to see if the patient has got the information or not, because you've got time constraints. So if you find, I'm not really 100% sure about this patient, don't do the test. Send the patient off, say, please, we'd like to get you counseled and get them done. But please try to incorporate these few questions into your normal consultation, because we have a serious problem in primary care where many people are saying, well, I'm not going to get into the HIV bit, I'll just refer to the counselors. Counselors are overwhelmed, and in fact, they take very long. They don't do what we think they should be doing. And then we're finding the numbers of patients that are being tested very low. And you, as a clinician, are in a much better position to actually get through that process. And it can be exactly as you consulting with the patient, that you can raise the idea, have you done an HIV test? If you need one, let's do one, but let me ask you a few questions and establish a few things about their knowledge and understanding and their sort of coping systems, who they will disclose to. All that was raised earlier. Quick questions, prick their finger while you're examining, you actually can get the result. But be sure that you're certain about this patient before you embark on that. Not be sure, but don't find a balance between trying to be perfect and actually trying to get help to as many people as possible. So I want to leave you with that to say, principally, pre and post-test counseling in fact, pre-test counseling should be all the issues dealt with. And you need to ask the patient, what if you're positive? What if you're negative? In post-test counseling, my practice, I actually say very little. What we need to be able to do is say, if this patient is positive, how do I respond? And that is not to tell them anything. Because at that point, if you're telling a person, and imagine yourself sitting on that chair and suddenly you're being told, well, you're actually HIV positive. The whole world, your life flashes by and it'll probably carry on for a couple of minutes. That doctor should do nothing more than just sit, wait, let that person collect themselves. Sometimes reach out and touch and you'll see them start crying. And I think you need to let that kind of emotion happen and then see where they are and then reinforce some of the issues you've just raised. Who will you disclose to? Okay, remind them of what they had said earlier. And so you should not be telling them any new information post-test. Okay, it's a short episode of support, but that pre-test you have established they have all that figured out. And if they don't have it figured out, send them to the counselor. You don't have the time. So please let me not hear if anyone who says, I can't do counseling, there's too much time involved. That's not right. It's not